The statements and opinions expressed in this episode are those of Dr. Sigman and his guests, and do not necessarily reflect the views of Veradigm.
It's time to do healthcare smarter. This is Smart Medicine, hosted by Dr. Scott Sigman and powered by Veradigm. To be a public servant is to put others before yourself, to answer a calling that gives a voice to those unheard. As a doc, I understand that calling, that drive to help, to heal, to make things just a little better. But what if your calling goes beyond healing people, to healing the entire system responsible for their care? That's rare. And that's exactly the mission of today's guest. Welcome to Season 2 of Smart Medicine. We're kicking things off with Secretary David Shulkin, former U.S. Secretary of Veterans Affairs, where he led the nation's largest integrated health system, supporting nearly 9 million veterans across the United States. Today, we're talking about his remarkable journey from clinician to national policymaker and why he believes collaboration between the public and private healthcare systems is the only way forwards. If you're fascinated by the reality of healthcare at scale, this episode will give you a look behind the curtain. Today on the Smart Medicine Podcast, I am joined by one of the most experienced and visionary leaders in American healthcare, Secretary David Shulkin. From leading major hospital systems to shaping national policy, Secretary Shulkin really brings a unique perspective on leadership and innovation and the future of American healthcare. Secretary Shulkin, welcome to the Smart Medicine Podcast.
Thank you.
So you've really had a fascinating career, from clinical medicine to hospital leadership to serving as the Secretary of Veteran Affairs. But I don't know that everybody recognizes that you still are a practicing physician in internal medicine. So let's start at the beginning. I mean, what inspired you to start a career in medicine?
Scott, I think you mentioned something, and that is I primarily still define myself as a doctor. I mean, that's the lens that I look at things through, is what I'm doing about helping people, helping patients, and do the decisions that I make, how are they going to impact that interaction of a provider and a patient? So, but, when I look back over my career and I try to give advice to people that are asking for my advice about their careers, I can't say that I planned any of this. The one factor that I would say that's sort of driven me through my career is curiosity and exploring questions that I don't know the answers to, following new things that are happening that I think are exciting. It just led me down a pretty interesting path. And part of curiosity is willing to take some risks. And sometimes those risks pay off and sometimes they don't, but they always are interesting in where they lead you.
Yeah, I mean, for innovation to occur, right, you have to have the courage to have that curiosity and to be able to accept the risk and hopefully move forward. So, yeah, I find it an interesting perspective. You started your career in internal medicine, but you look through the lens of all of the other things that you've done as a doctor-patient relationship, which really provides a unique perspective. But at some point, you pivoted from direct clinical patient care to focusing on some of the broader challenges of how healthcare systems operates. That led you to the University of Pennsylvania, Beth Israel Medical Center, Morristown Medical Center. So at one point or another, something sparked inside of you that decided that you wanted to sort of help solve this at a larger level, not just as that doctor-patient relationship. What sparked your interest to moving into more of an administrative side of things as well?
I do think it goes back to when you look around and you see things that are happening and you either don't understand why they're happening or believe that they're the right things that are happening. That's really a call to action for me. So back early in my career, when I had completed my internal medicine training, I wanted to get some advanced training in the business of medicine, in sort of the science of why decisions are made and how evidence is being used. And I did a number of fellowships in that area. But I remember the underlying trend that was happening in healthcare at that time was that I began to see the loss of autonomy of physicians in hospitals and, frankly, the birth of what we now know as managed care organizations, called at that time HMOs. And the reason why that industry grew up and why it became such a stronghold on the way that American medicine is run today is because physicians in hospitals completely ignored the cost of care. And the cost of care in this country is borne largely by employers, now government as well. But it was so uncontrollable, and there was such a lack of understanding and a lack of interest on the part of physicians and hospitals to deal with it. It basically was inviting a new disruptor into the ecosystem, and that turned out to be the managed care industry. And if you look now back upon that path, the independent physician, the independent hospital is close to all but being gone. And now we have these behemoth, massive multi-billion-dollar health organizations called health plans that really are making the decisions. And so I was very interested in trying to see whether, from a provider's perspective, going back to I look at things as a doctor primarily, could we actually regain some of that control? Could we alter the course of healthcare? And of course, what I'm really acknowledging is I certainly failed at that.
Well, I was going to say, I've been in practice for 30 years and they keep telling me that things are going to change, but it doesn't seem like we've had much more control, and it's becoming more and more difficult for us to practice every day with the buttons that we press and all of the regulations and things that are happening. But it is refreshing for us to hear that your passion is still about caring for patients and being able to try and help us in that regard. And clearly, leadership is in your blood. If you don't mind, I want to share a little bit of a heartfelt personal story for me from my days in the Veterans Administration. I'm a resident at the Tufts program in Boston in the early 90s. And we know that the VAs have helped to train so many physicians across our network. And so I'm at the Jamaica Plain. I'm a junior resident, a senior resident, eventually a chief resident, spent so much time there. And the experience was absolutely invaluable for me in my training, both as a physician and a surgeon. The veterans were unquestionably the most appreciative patients that I've ever had the privilege to care for. It was truly an honor to serve them. And then a number of my patients who were veterans went down to the Massachusetts State House and had a special declaration made for me and my fellow residents showing their appreciation of the care that we had provided for them. And that proclamation still stands on my wall, really as a reminder of the service, gratitude, and healing that we provided for those patients. So I just thought that was a sort of a heartfelt moment that I would share with you as your history within. So now, but going back, it's 2017, okay? You're unanimously confirmed by the U.S. Senate for the role of Secretary of Veterans Affairs. We look at the news today and the craziness of how people can't communicate. 100 to none in the Senate for your bipartisan acceptance. So you clearly were the right man for the job. What an incredible responsibility to take over what is the largest integrated healthcare system in the country at the time. So how did you handle that? That's a lot of pressure, complexity, moving from the private space into the government space. We'd love to hear that story.
I think we just need to understand that by just stepping back a little bit. This actually starts couple years earlier in 2014, the VA was going through what was called the wait time crisis at the time. We were having men and women return in record numbers from Afghanistan and Iraq with very severe injuries, many of them from these IEDs, these explosive devices where they lost arms and legs and came back with traumatic brain injuries. But at the same time, we had the Vietnam veterans now entering their mid-70s, requiring a lot of care from the VA, and the VA was frankly overwhelmed and just couldn't take care of all these veterans. That resulted in a political crisis where the secretary of the VA was asked to resign, the undersecretary was asked to resign, and frankly, Congress and the president needed to step in. It was about that time that I got a call from President Obama. I was running a health system in northern New Jersey, and the president asked me whether I would come in to help fix the system and fix this wait time crisis. And I said to the President, probably much like you would. I said, well, Mr. President, I'm honored, but I haven't been in a VA hospital since I was a resident. And I don't know anything about what's going on at the VA. You have tens of thousands of people who work in the VA who understand the system. And he said to me, well, that's exactly right. I want somebody from the outside. I want somebody with a fresh perspective who is known to manage hospitals and health systems in the private sector to come in and fix the system. So that sort of made sense to me. When the president's asking you to do something for the country, it's hard to say no. So I left my job and I moved to Washington. I thought when I got there, I might find the system was so broken that there was really no point in trying to fix it, that the best thing to do was to move the veterans into the private sector system, the system that I knew well, that I knew can work for patients. But when I got there, one of the things I did was I put on a white coat and my stethoscope, and I started going to the VA again and seeing veterans. And I remember my first patient was a Vietnam veteran who was in a wheelchair. He had lost both of his legs, and he had some pretty severe behavioral health care issues. He was very high that day on illicit drugs, and he was not particularly happy to be in my exam room, and he was cursing me out. And I remember thinking, if this were a patient in my last hospital where I saw patients, I would call security. I'd have him escorted out of my office because he was very disruptive. And I would send him a certified letter saying you should go see 3 other doctors. But I didn't, because he was my first patient, because I was running the VA. And afterwards, the physician assistant that had worked with me, who had been at the VA for a while, explained to me, look, these are our patients. This is what we do. We know how to handle patients with complex behavioral and medical issues. And this is where they belong. And I realized that she was exactly right, that had I sent a patient like this into the private sector, they wouldn't have been treated well. Some other doctor would have said, I can't care for this patient, and sent them to 3 other people. And so I realized that's exactly what the mission of the VA is. And the VA is set up to provide this type of care. And it's our responsibility as a country, when we send our men and women off to battle, to be able to care for them with these types of complex chronic illnesses. And so that made me a strong believer in my job, was to figure out how we could fix and improve this system and make it sustainable, not only for those that relied upon us, but for many future generations of people that will serve our country.
What a fascinating perspective. I mean, I can't imagine that too many secretaries of the VA went in and started seeing patients at a local hospital to really, truly understand. And that theme is very consistent in your messaging, that the most important thing has always been that physician-patient relationship. So really, kudos to you, and thank you for the time and energy, because that's one of the things I've always thought about. Why don't we have Medicare? We take care of our elderly and affirmed, and we put them through our standard private healthcare system. There's also a tremendous volume of patients too. I mean, if you think about taking all of those veterans and all of those facilities and then trying to put them into the private sector, what a workload or process or thought that would have been to be able to make that happen. I mean, you Secretary, you have an amazing perspective in healthcare, really at the highest levels of both public and private healthcare. And the two systems really have very different priorities, which just so intimately outlined, especially at the patient level, whether they're measured for success. Private healthcare, market forces, innovation, commercial payers. The other is policy access that you talked about, as well as accountability to our veterans to be able to provide that. So from your experience, what's the biggest differences between the public and private healthcare systems for leadership, efficiency, patient care?
I'll answer it on a couple different levels. First of all, when I first got to the Department of Veteran Affairs, early on, my staff said, we're going skiing in Aspen, Colorado. And I said, I didn't think that the government jobs were this cushy that we're going to take a ski trip so early on in my career. But my staff knew what they were doing. What they were bringing me to was what was called the National Winter Sports Clinic for Veterans. And when I got to Aspen, what I saw were 400 veterans, many who have lost their legs and arms, many who were spinal cord injury patients in wheelchairs, who were being taken out of their wheelchairs and fitted onto adaptive skis and being brought down the mountain in competitive sports. Now, you have to remember, when people join the military, they often join 18 or 20 years old in the prime of their life, very physically fit. Something disastrous happens to them, like they lose a leg in an IED explosion, and all of a sudden they're now in a wheelchair. And you could imagine their life becomes really difficult. Many want to take their life. They lose the passion for living. And what I found in spending a couple days with these 400 veterans, skiing down the mountains with them, that this gave them a rebirth and a rejoy in their life. It gave them that competitive spirit. It gave them a reason for wanting to live. It gave them a reason for saying, I don't need these antidepressants anymore because I now begin to feel some joy back in my life. And what I realized after that experience was that I had spent 30 years as an internist. And usually when a patient saw me, I would say, why are you here today? What's your problem? Well, my back hurts. Well, I'll take care of that. And then in 15 minutes, say goodbye. And I had defined my role as a physician as taking care of physical problems, where the VA defined healthcare differently. It certainly cared on the physical problems, but it cared also about the psychological, the spiritual, the economic, the holistic aspect of really having to address health and wellness and meaning of life. And that changed my perspective on what a doctor should do, what a healthcare system should do, and what my role and mission was. So that was one thing. The second thing is really more from a system level. I was used to running as a CEO of a health systems that were really made up of rules about what we would get paid for. Well, the managed care company is going to authorize this procedure or this imaging study, or we have to see patients in 15-minute segments because that's how we get paid. But at the VA, I would go to Congress and I would say, we're caring for 10 million veterans. I need this amount of money to be able to do it each year. And they would authorize that amount of money. And then I wasn't hamstrung by the rules of third-party payers. I could decide how that money should be best spent to care for veterans. If it meant supporting them with finding a home, if it meant providing them a service dog, peer support, caregivers, integrating behavioral healthcare with physical healthcare. Those are all things that we were free to do because they were the right things to do. But frankly, in a private system, none of those would be paid for. And hospitals and doctors just couldn't do those types of things. So that was one thing. The last thing I'll mention is that I had said when I went into the VA, I thought I might find such a broken system. I would teach the VA how to become an efficient, effective healthcare system because I was a private sector CEO. I was going to show them the way to do it. But in fact, it turned out to be exactly the opposite. I learned things about the VA and how they were managing the veterans that now I spend my time sharing those lessons with private sector CEOs. And probably the most important lesson that I learned was that VA would identify patients that needed help and go proactively contact them and address those healthcare issues. So, for example, when the hepatitis drugs came out that could cure hepatitis C, we went out and contacted every one of the 176,000 veterans that had hepatitis C and said, you need to come into the hospital because we have a way now of treating you. And today there would be less than 10,000 veterans who still have hepatitis C. When you're in the private sector and you're an orthopedic surgeon, you generally wait until the patient comes to you in the emergency room or the hospitalization. and you wait until they're sick until they get help. But in fact, what we should be doing in healthcare is reaching out before they get sick, addressing chronic illness by going proactively into the community and addressing it rather than waiting until it's so severe that it's hard to cure or much more expensive to take care of. And so this system of population health that the VA does is really the system of healthcare that I've come to believe in.
Fascinating. So reactive versus proactive. I love the holistic approach that you talk about at the VA, both the psychological as well as the physical. I like to say that as an orthopedic surgeon, I take care of shoulders, but that shoulder is attached to a patient. And thinking about the entire perspective of that patient well-being, I think is wonderful. There really is some great synergies between what we can do in the public sector and what we can do in the private sector as well. So how do we find that balance, right? It seems to me like you're the perfect person that really has sort of experienced that. Now you're consulting and innovating and really, so what's your counsel to the private healthcare world right now when you speak to these CEOs about what they can do things better?
I do think that there are many lessons and ways that the private sector and the public sector need to work together. Obviously, government now is the majority funder of healthcare. There are still populations of patients that do not have good or unfettered access to healthcare. And so we have to stop looking at the reimbursement system and the access system and the outcomes as separate things in healthcare. And we need to begin to start looking at them as an integrated system. And part of the reason why healthcare has been so slow to change is because we're so fragmented that looking at things in a more integrated fashion is, I think, really needed in order to provide some of these solutions. And look, we're talking at a time when our government is shut down, and it's shut down largely over this healthcare issue where you can't even get both sides to sit in a room to talk about it, even though there's a lot of agreement. The political polarization is a more powerful force than doing good for people at this point in time in our politics. And part of the challenge that I had being a private citizen pulled out of the role in the private sector, put into healthcare was I wasn't there for political reasons. That didn't matter to me. I wasn't running for anything. I was there to try to fix our system for our veterans and out of a sense of public duty. And so I found myself not having many friends in Washington because I didn't want to be part of it, either the spectrum on the right or the spectrum on the left. In fact, when I left government and a number of senators held a reception for me, the head of the Senate's Veterans Affairs Committee, who I worked closely with, said, I've worked with Secretary Shulkin for 4.5 years, and I couldn't tell you today if he's a Democrat or Republican. And I said, Senator, that's perfect because it really shouldn't have any relevance. When men and women serve our country, I hope that we're not just getting Republicans or Democrats that are willing to do it. They're all doing it out of a sense of unifying the country. And so I do think that the solutions need to come from the center. And compromise should be the way that we get things done in Washington. But unfortunately, that's just not the environment that we're seeing today.
I've got to say, this conversation with Secretary Shulkin has really surprised me so far. It's a great reminder that sometimes being an outsider is exactly what makes you valuable. When you walk into a world that feels unfamiliar, that fresh perspective might just be the reason you were invited in. Secretary Shulkin was chosen because he's a physician first, and that clinical lens, paired with a genuine drive to make a difference, let him chart a new path where mission and vision could finally work in unison. And that word unison, it really sticks with me. Before we get back to the conversation, this episode of Smart Medicine is powered by Veradigm. Veradigm helps healthcare organizations work smarter by connecting data, technology, and insights to improve outcomes. Learn more at Veradigm.com. I find it fascinating that both President Obama and President Trump both selected you for the same sort of reasons, which was you were an outsider. You weren't part of the inside of this to try and come in and fix it. So that was common ground for those two individuals as well. And you were square there in the middle. Let's talk about a few other things that, as we're sort of coming to a close. And one is physician education, right? I mean, the VA plays such an important role in the education of our residents and young doctors across the country, across all subspecialties. And do you see that? What do you see the future of physician education within medical schools and the VA as far as that continued process of being a breeding ground for wonderful education for our future doctors?
Yeah, I don't think many Americans recognize that about 70% of physicians who are trained in the United States will spend time during their education in a VA, either as a medical student or resident. So it is formative, just like your story, in the training and the development of our workforce. But it's not just physicians. The VA is the largest training force for nurses, for physical therapists, social workers, pharmacists. You could go down the list. And so without that as a educational system to be able to help train, I think all Americans would suffer because they rely upon this type of training. And this was not a system actually that came about by chance. General Bradley, who was a famous general in the World War II era, after he left office and had a chance to run what was known as the Veterans Administration back then, he actually set up and built VA medical centers right next to our best academic centers throughout the country. So when you travel the country, as I have, to visit these centers, they're co-located next to each other. And so residents and students can flow back and forth, and faculty can go back and forth. In fact, I often tell a story of a veteran who goes to see their VA doctor and a heart surgeon at the VA, and the heart surgeon at the VA says to the veteran, "Look, I think we're going to need to replace your valve, and that's going to fix you, and we can do that here for you." And the veteran says, "Look, I don't know if I'm getting the best care at the VA." So he waits a couple months, gets an appointment at the university, the academic institution next door, goes through the evaluation, sees the doctor, and says, "Doctor, what do you think?" And the doctor says, "Well, like I told you a few months ago when I saw you at the VA, you need to have your valve replaced." And so these are the same doctors that work at
literally
the VA.
Walking across the street.
Exactly.
Literally, you can walk across the street between the two facilities.
It's those academic educational relationships that make our veterans really have the best type of care that's possible.
Yeah, so well said. Another great story. So innovation, I firmly believe, requires partnerships and collaborations across a broad spectrum, right? So we have academia. We've talked about that just now. You've been in the private healthcare space. You've also been in the public space, but also private industry, right? How is this partnership going to come together? We have artificial intelligence. We have digital health and new care delivery models that are coming down. What's your vision for the public, private, and industry working together to help solve some of these technology issues?
We're at a time where the change that's happening is at a speed that none of us have ever seen before. And some of the problems that we've been experiencing for decades actually now look like there are solutions coming down the road. Of course, depending upon how you look at things, there can be new problems that arise because of how quickly we're moving and the fact that technology and science will now move faster than policy or regulation or systems that we have to be able to monitor it, quite frankly. But I think that there's a lot of opportunity here. I do believe, and maybe it's because I've sat on both sides of this is an opportunity for more public-private partnerships. And I only look towards one of the more recent examples, and that was Operation Warp Speed with the development of the COVID vaccine. And no matter where you end up thinking about whether vaccines are good or bad, I will remind people more than 1 million Americans died with COVID. And that was before we had the vaccine. We all desperately were hoping that science would provide a solution, which it did. And it did it in record time in a public-private partnership where I think it was well done and should be replicated many times over on some of the toughest problems that we still haven't found solutions for. And so I do believe that when you combine the new science, the new technological abilities, the ability of the private sector to work with the public sector, government, we in this country have some tremendous opportunities that if we could harness all of this together and focus on the right priorities, we could really make great accomplishments in the next couple of years.
Secretary Shulkin, you really are a breath of fresh air in this partisan political world in which we live at this point. I feel like I love a saying, right? Calling balls and strikes. And you are an umpire. You call it like you see it. These are the facts. We'll leave the politics out of it and let's come up with strategies to make humankind better as we move forward with healthcare. So let's talk a little bit about that, the future, right? You and I, we're a couple of old guys here talking about our decades-long experience of treating medicine and doing things. But as you said, there's exponential technology development happening as we speak. What's it going to be like in 10 years? What do you envision how healthcare is going to be delivered in the United States in 10 years? Just give us a ballpark.
Well, first of all, the good news for you and me, Scott, is that the science of longevity is also coming along pretty quickly. So
we're looking pretty good, the two of us.
So
we're doing
you
all
and
right.
I should be in good shape. And as long as that science continues to develop, I do think that people will be living healthier, more functional lives for longer. We certainly have an incentive to see that happen. But I think it's very hard to know where all of this leads us. One thing I do know is that we probably won't be talking in the future for much longer about artificial intelligence or AI because it's just going to become a way of life. It's not going to become a thing. It's going to be the way that we all get things done. And, what's great about being a little bit older is you can look back at some of the more recent generations, and they don't know what the world's like without the internet, without cell phones, and without all the things that where we grew up, we just didn't have those. And that's the way that the world's going to be like, and science is going to be like with artificial intelligence. It's just going to be part of the way that the world works. And I hope that extra time and effort that no longer needs to be done with a lot of menial tasks allows us to put humankind's efforts and focus into things that really do improve society, help lift everybody up, not just those at the top of the pyramid, and allows us to tackle some of the really critical things that threaten mankind right now if we don't begin to address them.
Incredibly well said. As we're coming to a close, we usually have a little bit of a rotating segment here. We call it a lesson in leadership. You've been in some tough positions previously, right? You've had to make some tough calls. So give us one leadership lesson that you learned the hard way, a moment of experience that maybe tested you, but still guides how you lead today and provide counsel and experience.
I think that, to me, the biggest issue in leadership is having principles. And so when you're in a leadership position, if you're asked to bend your principles and you decide that the job is more important than your principles, I think that's where you begin to start getting in trouble. And so I came across that in government. I ended up getting a tweet one night that the president fired me. And you know what? I wasn't bitter about it because that's the job. When you are in the president's cabinet, you serve at the pleasure of the president. The president should have the people around him that he wants and believes in. And as long as I felt that I was adhering to the principles of what I was there for, which was to build a system and to continue to protect the system for our veterans. The reason I came, I was okay if that was the result. What I wouldn't have been okay with is bending my principles just to be able to keep that job and keep that position. And so I hope that there are others in government that our system was designed not to have career political appointees, but to have people from private sector step out of those roles, come and serve, and then go back into the private sector. And we need more people like that, and we need them doing it for the right reasons.
Yeah, well, we can't thank you enough. Secretary Shulkin, thank you for joining us today. More importantly, thank you for your extraordinary contributions to medicine, your service to our country, your leadership both across the public and private healthcare sector. You really have helped shape the way Americans receive medical care. We thank you for your continued work in innovation and policy and helping to define what the future of smart medicine can be. It's been an honor having you on the show and learning from your journey.
Thank you. I appreciate the opportunity.
What incredible insights from someone who's seen healthcare from such a unique perspective. Here are my takeaways. Curiosity and courage drive innovation. We have to want to know more, want to change, and have the guts to actually do it. Integration over fragmentation. Public and private sectors have to work as one connected ecosystem because cost, access, and outcomes aren't things you solve in silos. Leadership is rooted in principle. Never sacrifice your values for the job. True integrity in healthcare means putting patient wellness above everything else. And to me, that's smart medicine. So there you have it. Smart Medicine is officially back for season 2. We've got more big conversations coming your way, so stay tuned. I'm Dr. Scott Sigman. Thanks for listening, and I'll see you next time.